Hi everyone, Dr. Remy from Pain Free and Fit. Today, as per subscriber request, we're going to be going over how to perform curtsy lunges with lower back spondylolisthesis without hurting yourself. Hope you enjoy. So a curtsy lunge is a great variable in leg training to help develop especially the adductor and abductor muscles of the hip and thigh, as well as the quads, the glutes, the hams, and the calves. However, there are three main problems you have to watch out for. While performing a curtsy lunge, where one leg steps back and diagonally across and you bend your knee, the first mistake that many people with spondylolisthesis have is they increase the arch of their lower back in the leg going back motion. As you can see from the side view, as my leg goes back, there's a tendency for my tailbone to tilt upwards and my arch to increase its angle. To resist this, keep the tailbone tucked under by raising the pubic bone towards your chin and tucking your tail under a slight bit. Again, how much has to be in a comfortable range of motion for you. And use some abdominal tension as if you're doing a slight crunch by lowering the bottom of the front of your rib cage down towards your pubic bone. This will engage your abs and help hold that curve in your back so it doesn't increase as the leg goes back and across. The second most common problem with curtsy lunges is hip hiking, where one hip will elevate upwards, and this is usually associated with the same side rib cage and shoulder dropping down, thus compressing that side of the back and irritating facet joint pain as well as any disc herniations or bulges if they exist. Pain on the opposite side can occur from an overstretching of ligaments, joint capsules, muscles, and tendons. To analyze this and prevent it in your curtsy lunge motion, keep both of your hands on top of your pelvic or hip bones as you look at yourself in front of a full-length mirror. Watch the first motion that as one leg moves back and across, the hip does not swing away from that standing side. In this case, as my left leg moves back and across, the mistake would be excessive motion of my hips moving to the right and swinging upwards to start that hip hike motion. To prevent this, slow down the motion and keep that lead leg hip in and down as you perform a slow motion of the leg leaning backwards and across. As you continue to bend your knee, emphasize a downward swing of that hip as well as keeping it inwards to maintain a level pelvis. Also watch out for the rib cage leaning in, making sure that it's level, shoulders, and bottom of rib cage. As you perform this slowly and get better at it, you can increase the speed to eventually performing a quicker curtsy motion. The third most common mistake with curtsy lunges is pelvic rotation, where the pelvis twists away from the lead leg side. To analyze this on yourself, feel your pelvic bones on the front of your pelvis. Moving from your belly button outwards and slightly down, there'll be two projections known as your ASIS bones. If you feel them, you can monitor this motion from happening, especially during the very first aspect of the curtsy. As you bring your leg back, avoid the tendency to turn the pelvis away by moving the pubic bone in towards the lead leg side. Maintain this tension inwards as the leg goes back, and you further develop a deeper curtsy range of motion. So plug these tips into your routine and let me know how you make out with your curtsy lunges and your spondylolisthesis. Questions or comments, write in. As always, I'll do my best to answer. Give me a thumbs up to help share this valuable information with others. And remember, if you're looking for a great way to analyze your body mechanics, your muscle imbalances, what your core stability issues are in your lower back, and how to prevent problems from happening with spondylolisthesis due to improper mechanics, and how to build a self-rehab program to strengthen your back to prevent spondylolisthesis pain, check out our fast-track program for spondylolisthesis available at painfreeandfit.com.